Hey guys, very quickly, let's talk through knee, medial, and lateral rotation. First of all, a few things have to be happening for this rotation to occur, okay? And naturally, when we go through flexion and extension in a closed chain movement, meaning my feet are grounded, it's a closed chain, I'm transferring that force from the ground up or from some other surface up, okay? You're going to see that rotation. It's extremely subtle. So as we come into flexion, you see a little bit of rotation. As we come to extension, you see a little bit of rotation. All right, so I want you to also think about it from the perspective of I'm like cutting. Okay, that's where we could really see that medial and lateral rotation occurring. So we're looking at this leg here. And again, all of these situational factors have to be happening. You have to have flexion of the knee. If I'm locked out, if I'm fully extended, there is no rotation. Can't happen. Okay, so it has to be flexed, has to be grounded, and it's also passive. You don't sit there and think, I'm going to rotate my knee today. I sure hope not. That's why most of us, when we think about the movements of the knee, rotation never even crossed our minds. We thought it extends and it flexes, and that's it. When that happens, in order for that to happen effectively and for good transfer of force through all of those biarticular muscles and things, you have a little bit of rotation there, okay? So as I'm down in this nice little squat position and I go to rotate, we're looking at this leg, I want you to think about what's happening there. My tibia and fibula, really it's my tibia that's in that articulation with my femur, with those condyles. He's still lateral, and my femur is medial. So I'm trying to illustrate that concept there, okay? We see what I'm talking about. You can see my fist going. You got to think about the distal segment. When we're determining if it's lateral or medial rotation, we're referring to the distal segment. So my tib's going out, my femur's going in. Now if I'm turning this way, right, that femur, and you can feel that pressure in your knee when you're going through this. So be careful here. Your knee is not designed to have extensive rotation. It's very subtle. That's why most of you didn't even know that it ever happened in your knee until now. So if I'm taking my femur this way and my tib's still going inside, my femur's going out, that's going to be medial rotation of the knee. Okay? The reason that they show you in books to demonstrate internal and external rotation of the knee, they show somebody on an exam table and they have somebody, they flex their knee and then they're subtly twisting the shank in both of those directions. Again, that person's foot isn't grounded and it's passive. It has to be passive, so they're having someone actually manipulate the shank to demonstrate how that rotation would occur. You can't just pick up your foot and be like, I'm going to rotate. No, that's hip. When you see that manifest, it's coming from my hip. It's not coming from my shank, my tibia rotating in that joint right there, in that knee joint. I hope that helps. Also remember that that is going to be a transverse planar movement with that longitudinal superior, inferior, or vertical axis. Okay, that's also hard to conceptualize too, because you got to think, if I'm in flexion and I'm rotating, it's hard to envision that the plane is transverse and that this is running through it, because positionally we're not standing straight up where we have that pretty rotation occurring there. We have a flexed knee. So that kind of messes with our perception of where that plane is in space. Always remember that you're taking the joint back to anatomical position in order to analyze its plane and its axis. So just because situationally, meaning grounded, flexed knee, all that, just because that's the case, that doesn't mean that you still don't take it back to anatomical position to look at what the joint is actually doing in regards to its plane and its axis. I can't even talk. Transverse plane, longitudinal axis, medial and lateral rotation of the knee. Grounded, passive, with knee flexion.